Hi, and welcome to my channel. Just kidding, I don't have a channel. This is actually the first video that I've ever recorded for something like this on YouTube, and because I'm a Zennial and I don't do this for a living. However, I wanted to record this video and talk a little bit about what I'm having done for a surgical procedure on Monday, which is in 4 days from now, because I have found some information about it online and some videos about it, but not a lot of videos about it. And apparently it's a fairly common procedure. I am having a Simplify is the brand cervical disc replacement in my C6, C7 cervical vertebrae space in my neck, because my disc in that area is completely shot, apparently. So, like I said, I'm 43 years old. Some of the videos that I've watched don't really say how old people are, or at least they may mention it like midway through a video or at the very end, and so you're like, I don't even know if I relate with this person or not. So I'm having this done December 23rd, so early Christmas present, I don't know, and it's going to be with Dr. Jeremy Shaw, an orthopedic surgeon who works out of LDS Hospital up in Salt Lake City, Utah, which is where I live. So just a little bit of background and things which would lead up to this surgery, this particular surgery that I'm having. So I apparently have had some wear on my neck, as most people do by the time they reach their 40s. But a lot of the time this wear is from like an event of something that happened, or that you did, like an accident or an injury of some sort, which kind of happened to me. I have had issues with my neck for about 2 decades, off and on for about 2 decades. And I did kind of injure myself last month, maybe about 2 months ago. Yeah, so actually it's been about 2 months ago. So first off, I'm a runner, so I've been running for about 30 years. I guess running can put some wear on your neck, also other places on your body, but I have been running for about 30 years. I've run 3 full marathons, multiple half marathons, probably a couple hundred city races and other things over the past 30 years. I don't know, I haven't really counted. But I ran in high school. I ran for the track team and for the cross-country team as well. And I still try and run to this day. It's kind of the thing that I do. I try and stay active. I try and stay healthy. I've done a lot of HIIT workouts over the past 15 years or so as well. I like to cycle. More on that in a minute. And at this point, I'm kind of walking a lot. I also like to lift weights, but if you have problems like I do, sometimes lifting weights like arm weights, shoulder weights, things like that can cause you to feel like you have the flu for 4 days afterward. So it's been a bit of a struggle. So I have had a lot of things done over the past 20 years. I've had multiple x-rays, I've had CT scans, I've had MRIs, I've done a lot of conservative treatment, going to chiropractors, physical therapy, heat and ice, like massaging, like pure waves type stuff, and then also like creams and things like that. A lot of you may think, like, after you've done all of that and you're still in quite a bit of pain, the next step is injections. So I have a bad history with steroids. I've had 2 meniscus repairs, one on each knee, because I'm a runner, and have had cortisone shots in each knee. I've had a cortisone taper for a back injury, and I don't do well on steroids. Like, I have all the side effects. So getting steroid injections into my neck isn't great for me. Also, with physical therapy, I go to like a manual physical therapist, like a hands-on physical therapy. They do like EMS stem treatment, they do scraping, they do dry needling, they do cupping. I've had all that done. Manual manipulation, targeted exercises, different stretches, everything you can think of, I've tried. So about 2 months ago, I was doing some yard work and feeling pretty good. Typically, I would not feel very good, but I was feeling pretty decent that day. We were cleaning up the yard for the fall. Like I said, I live here in Utah, so about mid-October, it's time to pull out the garden. It's time to get rid of all your tomatoes. It's time to get the leaves taken care of, all of the fun stuff. We had spent most of the day cleaning up the backyard, cleaning up the garden, and we had all of these bags of yard waste. So we went to put them in a dumpster, and I was putting bags in dumpsters, and the very last bag that I picked up, I kind of picked it up. I was like standing perpendicular to the dumpster. It was like a bigger neighborhood dumpster. I picked up the bag and I like hefted it up and over into the dumpster. And as I did that, I like kind of looked up to make sure it was going where it was supposed to be going. And I felt this like snapping, pulling feeling, like zinging down the back of my scapula traps area and down the back of my triceps. And then it kind of wrapped around into my biceps, and then it stopped, and I was fine for like a day or two. And then all of a sudden it all came back like with a vengeance, and it hurt. And it was like this dull, deep, aching pain down my side of my upper back on my right side, and down into my biceps and around into my triceps. So I went to physical therapy a couple days later. I was able to get some muscle scraping done, like some manual manipulation of my scapula, which did not feel good at the time, but after I left, it felt a bit better. And then a couple days later, it just all came back. That it started with a little bit of like pins and needles, some arm weakness down my right arm, etc. So that was towards the end of October. The first week of November, my family and I went on a 1-week vacation down to Disneyland, and that entire week I was in some pretty not fun neck and back pain and arm weakness and not fun stuff. So I ended up being on a rotation of Tylenol. I brought down a heat pack. I was using my Theragun, and I was trying to take some ibuprofen, but I try and take not as much ibuprofen these days as I used to, but would take that occasionally as well. So that's where I was for an entire week, plus we drove. So I was in a car with that fun stuff going on for about 9 hours as well. So when we got back, kind of tried to make it through the next couple weeks through Thanksgiving. I was out on a run and I tripped and I fell. Ironically, did not fall on this side of my body. I fell on my left side, but I fell, hit my shoulder, hit my knee, and I don't know if that jarred something in my neck, because the pain started coming back a little bit as well. So I ended up getting an MRI, and this is at least the third MRI that I've had on my cervical neck. I may have had another one that I don't have paperwork or documentation for, but I've had at least 3. The one that I know of, the furthest back, was in 2015, and that MRI showed that I had mild degenerative changes in my C6, C7 vertebrae, but no spinal canal or foraminal stenosis. So it was just kind of like, okay, you're maybe getting a little bit of, wear in that disc, which is normal-ish for somebody that would be in their, mid-30s. And so I was like, okay, not a problem. I did go to a little bit of physical therapy at the time, and it kind of helped a little bit, kind of didn't, and kind of started being a little bit better. I had neck pain for a while back from 2015 on, because I've had neck pain for decades, but in 2022, I had another MRI, and the MRI in 2022 showed that I had moderate to severe right-sided foraminal stenosis, and it also was showing that I had impingement of the exiting C7 nerve root. So that was consistent with my pain that was in my kind of my trapezius area, my back, and then the pain that I sometimes get, like shooting up the side of my neck and the back of my neck, and just pain in general. So I kind of hit physical therapy pretty hard in 2023 to now. I've been going pretty much consistently. I try to go at least every other week, if not at least once a month, and I kind of get like a good tune-up. And I've been doing that for about the last 1.5 years with the same physical therapy office. They're really good. It's a manual, like a hands-on physical therapy. They do it all, like I said, and it's phenomenal. They make you feel better than when you went in, and you can kind of manage. And I believe honestly that is what's been helping me manage my pain for the past 1.5 years. So this last MRI that I had in November, following this pain that the pins and needles that just wasn't going away, and the neck pain that just wasn't going away, basically was like, you are no longer at moderate to severe, you're at severe. Like, you have, basically your vertebrae is compressed, like your disc isn't there anymore, like your disc is not helping you anymore. That nerve root is completely compressed. Depends on how I move my neck, but I have had consistent pins and needles and consistent weakness for about 2 weeks now. So I went to see the surgeon. He told me about this cervical disc replacement, which is such a better option than neck fusion, which I thought was in my horizon. So basically what it is it's like they go in anteriorly, so just an incision on the front of my neck, and he's just going to take out the crappy disc, put in a new little piece of, it looks like a Lego. It's so not very big, and it's just like 2 little pieces with a little piece in the middle that can rock, and it's going to just go straight into that disc space. He's going to clean out all the degeneration of that gross disc and clean all that out and put this little piece in, and basically it will be pretty much as stable as it will ever be. So the little device, like I said, was a Simplify cervical disc. It's made of a medical grade plastic with a ceramic core and a titanium something. There's titanium in there somewhere. So I get to be part bionic person soon. I've made peace with the fact that this surgery is happening 2 days before Christmas. I'm going to do my best to get through Christmas with my 3 kids. They're all, briefed on this and realize that I may just be down, but I'll do the best that I can. So, yeah, so that's where I'm at. If you're seeing this video, it probably means that I am fine, because I'm going to post some other videos, hopefully day of surgery and some recovery days after that, because what I want to see is how somebody is progressively getting better and what their outcome looks like as far as getting back to work and getting back to family activities and all of the things that they love. So keep posted, and I will continue this in a few days.